In the midst of the nation's opioid epidemic, the most heartbreaking cases are often the youngest. Newborn babies born addicted. As the state tries to figure out a systemic way to track them, King 5's Elisa Hahn shows us what's being done to treat the newborns.
All newborns need delicate care. The 7-week-old baby boy is alert but calm as he gets his bath.
Hey, you got a scratch on your nose.
Nurse Kelly Denhire checks his vitals.
He's holding his legs pretty stiff.
The casual observer may not see the signs that this baby was exposed to heroin, methamphetamine, and methadone while he was in the womb.
We also check to see if they have increased tone in their legs and arms.
The muscle tone comes from the uncontrollable tremors of heroin withdrawal.
Hey, buddy. You doing, huh?
All 7 babies here at the Pediatric Interim Care Center in Kent were exposed to opioids before they were born.
Normally when they're in more severe withdrawals, they're more irritable, but he's not irritable.
Unlike the other drugs, the babies often need to be weaned off the opioids. So Denhire reaches into a cabinet to get a small dosage of morphine, which she administers to another 1-month-old baby as an oral medication. Nurses decrease the dosage every day based on a scoring system for a list of symptoms they see.
If he wasn't tolerating his wean, we may already know it by now. He'd be kind of fussy and getting more irritable throughout the day.
It's sad to see the number of drugs in their system. It's a rarity to see one drug or 2 drugs.
Executive Director Barbara Drennan says unlike the 90s when the center first opened, they see more babies coming from middle-class homes as opposed to moms living on the street. Moms often taking OxyContin and transition to heroin.
These moms have homes, they have cars, they have money to go to the store and buy a gallon of milk. It's a different population.
The babies can stay here at PIC for up to 12 weeks before the state places them with a relative, foster care, or back with a parent.
Where the babies go, thank goodness, we have no say. But quite often we're in tears when they leave. But they're happy tears a lot of the times, and that's what's important.
Here we go, here we go.
In Kent, Elisa Hahn, King 5 News.
There you go. So of the 79 infants the center cared for last year, 71 had prenatal exposure to opioids. They can stay at that center for up to 3 months. According to the nursing staff, if the babies get the proper care to wean them off the drug, there should be no long-term impacts of that exposure.